Welcome back. Lung cancer. It is by far the leading cause of cancer deaths among both men and women. And recent studies have shown that 1/3 of Americans skipped their cancer screenings due to COVID-19. Now, November is Lung Cancer Awareness Month, so we have Dr. Glenn Van Otteren from Spectrum Health joining us this morning to tell us more about the month and talk a little bit about COVID, too. First of all, welcome to the show. Thank you so much, Doctor, for coming. I know you're very busy. You're treating some of the most ill patients you've got there, so thank you for spending time with us this morning.
You're very welcome. Thank you for having me this morning.
Absolutely. Tell us, who is at risk for lung cancer? When we were growing up, a lot of us thought, well, this is just for smokers.
And, that's largely true. There are multiple risk factors for lung cancer, tobacco exposure being the most significant. It accounts for about 85% of all cancers that we identify. There are other risk factors as well, advancing age, exposure to asbestos, radon, other occupational exposures. But certainly tobacco exposure, either direct personal use of tobacco products or significant secondhand exposure places patients at risk for cancer.
So when it comes to getting screened for lung cancer, obviously no one wants to be diagnosed, but if they are diagnosed, diagnosis being early is key. So what screening options are available and how do they compare to other cancer screenings out there?
Well, you make a great point. With lung cancer in particular, we know that given that the risk factor of tobacco exposure is more significant, we capitalize on that and have studied a screening tool called a low-dose CAT scan. And when used in the appropriate setting, those patients in a particular age group, age 55 to 80, and those that have been exposed to a significant amount of tobacco exposure, we quantify that as 30 pack years. So 1 pack per day of smoking for 30 years, for example. Those individuals, if they undergo a low-dose CAT scan, we can identify cancer in the earliest stages. And that's the whole problem with lung cancer is if we wait for symptoms to occur, then the cat's out of the bag. Our ability to treat those patients and get a good result is very, very poor. But if we use this screening tool and put patients through this screening process that are appropriate, we can pick up lung cancer very early and have really good outcomes, largely with surgery or radiation therapies. So that's why it's so important that we let people know that there is an effective screening tool and use a lung cancer CAT scan like we do colonoscopy or prostate screening or mammography for breast cancer screening. So that's the important message to give to people.
So that screening is so very important to get early. As you said, the cat's out of the bag if the symptoms have showed up. Let's talk a little bit about COVID-19. Obviously, this is it's a pulmonary, it affects the lungs, and it's a respiratory virus. So what have you seen when it comes to the COVID-19 and what you're seeing in where you guys are working?
Yeah, I'll be totally honest with you. It has overwhelmed us, or nearly overwhelmed us, I should say. It's preoccupied us substantially over the year, but particularly in the last few weeks. We've seen in Grand Rapids an extraordinarily unprecedented increase in the number of testing positives. Today, for example, 20% of the people that showed up for testing yesterday were positive for the COVID virus. That's never been close to that and has increased in the last few weeks. The number of positives yesterday was nearly 600, again, a record. So this is getting worse. So the message to the community is this is not something that's made up. It's absolutely real. As soon as I'm done here talking to you, I'm going to go back and resume my role today, which is a second provider in the Blodgett Intensive Care Unit, where we have 18 COVID patients fighting for their lives on ventilators right now. So it's a real deal, and this is not something that we're making up or exaggerating. And so people need to take it seriously. That's my main message. It clearly is a disease that affects the lungs. It causes a tremendous amount of inflammation. And although nobody deserves this virus, absolutely not. Some people are at higher risk for complications, those that suffer from diabetes, hypertension, or are overweight or elderly. But I can tell you personally that we see people suffering from this virus that are perfectly normal people prior to this illness. And, I had a patient, 35 years old, die yesterday in front of a whole team of us trying to save his life. So this is a real deal, and people need to be aware of that.
Doctor, we can't thank you enough for what you and your staff are doing. To hear those numbers, 35-year-old, not just something that affects the elderly. Make sure that you are taking good care of yourself. Doctor, we'll let you go. We know that you are very busy. As you mentioned, 18 people in the ICU right now. Get over there and help those patients. Thank you for your time.
Thank you very much for having me.
Absolutely. You want more information? SpectrumHealth.org. We'll be right back.